Hi, this is Andrew Lane, RN, for Nurse 541, Population Health, in the MSN Clinical Systems Leadership Program at the University of Arizona College of Nursing. The presentation is on population at risk. Arizona motorcycle riders are a population at risk. Arizonans ride. There are over 180,000 registered motorcycles in Arizona alone. Arizonans crash. 3,081 motorcycles crashed in 2013. 2,519 people were seriously injured in those crashes, and 149 people died. Arizona helmet laws. There isn't one. Arizona does not require helmet use. National information states that in 2010, motorcyclists made up 14% of all traffic fatalities, but accounted for less than 1% of all miles traveled. The federal opinion is that helmet use consistently has been shown to reduce motorcycle crash-related injuries and deaths, and the most effective strategy to increase helmet use is enactment of universal helmet laws. That's according to the CDC in 2012. Arizonans are at risk. Arizona motorcycle riders are at risk for injury and trauma and death due to lack of regulation of helmet use. Healthy People 2020 topics and objectives includes injury prevention in their objectives for public health. We need to raise awareness among Arizona motorcycle riders, especially Southern Arizonans that we serve, about the importance of helmet use. Can you imagine if any of these people in the pictures shown were not wearing a helmet? Motorcyclists are members of the general population. Their health needs and health literacy are the same as those in the general population, with the added risk for injury. We need to get involved with primary prevention in this issue. We should be active in public education, partnered with our trauma outreach program, our county health department, and local law enforcement. If we reach enough people, we can hopefully reduce the injury and fatality numbers. We can provide literature and education to motorcyclists about the benefits of helmet use with real-life examples and the real costs associated with trauma and recovery. By attending social gatherings where motorcycles are present, such as street fairs, county fairs, music festivals, bike nights, charity motorcycle rides, we can provide the literature and education to motorcyclists. We could sponsor and staff a table, present written materials, share personal interactions, provide swag. Who doesn't like swag? This is all going to cost money, unfortunately. There are grants available for this sort of outreach, and a separate cost analysis could be presented in the future. There are plenty of motorcycling focused community groups right here in Arizona, especially saferoads.org, amsaf.org, the Arizona Motorcycle Safety and Awareness Foundation, and RiderArizonaMTC.com. Folks are located right here in Tucson. These education events would go on throughout the calendar year. During that time, the trauma department clinical research team could work together to collect injury and helmet use data. Since we're the only trauma center in the region, it should be fairly comprehensive. Then the data from the year from the Department of Transportation would also be reviewed once it's published to bolster that data and used for analysis of effectiveness of our programs. There are some barriers to this type of outreach. Now, the largest barrier is the lobby against helmet use and against helmet laws due to the restriction of freedom. Arizonans don't like that. Motorcyclists don't like that. So we should avoid the talk of legislation. Arizonans enjoy their freedom. The state has a long, proud history of supporting states' rights and the rights of its citizens, so we should respect that, especially if we want to have any kind of impact in this area. Arizona motorcyclists are at risk for trauma due to the lack of a state helmet law. We as public health providers can positively affect the scope of this risk by educating motorcycle riders on the benefits of wearing helmets with the right approach and with the support of other like-minded organizations. We should work to reduce the risks encountered by the members of the communities we serve.